Welcome to our comprehensive guide on high-yield child health topics for the NCLEX exam. In this video, we'll break down the most important areas you need to focus on to maximize your score. Child health is a significant portion of the NCLEX, covering everything from growth and development to common pediatric diseases and nursing interventions. Whether you're just starting your review or looking for a last-minute refresher, this video will help you prioritize your study time and understand what to expect. Let's dive in and start with the basics before moving into more detailed content. Understanding normal growth and development is foundational for child health questions on the NCLEX. You'll need to know the major milestones for infants, toddlers, preschoolers, and school-age children. This includes physical growth, cognitive development, and psychosocial stages. For example, knowing when a child should start walking, talking, or developing social skills is crucial. Questions often test your ability to identify abnormal patterns or delay. As we move forward, keep these developmental stages in mind as they influence assessment and care planning. Infancy is a period of rapid growth and change. For the NCLEX, focus on milestones such as rolling over by 4-6 months, sitting unsupported by 6-8 months, and walking by 12-15 months. Language development like cooing and babbling also begins in this stage. Nutrition is another key area. Breast milk or formula is recommended exclusively for the first 6 months. Immunizations start in infancy, so be familiar with the recommended schedule. Recognizing normal versus delayed development is a common exam question. Toddlers are known for their increasing independence and mobility. Key milestones include running, climbing, and beginning to use simple sentences. Toilet training typically starts during this period. The NCLEX may ask about safety concerns, such as preventing falls or choking hazards, as toddlers explore their environment. Nutrition transitions to solid foods and picky eating is common. Understanding these changes helps you answer questions about anticipatory guidance and parental education. Preschoolers continue to develop language and social skills rapidly. They become more imaginative and begin to form friendships. Motor skills improve, allowing them to draw shapes, use scissors, and dress themselves. The NCLEX may test your knowledge of age-appropriate play and learning activities. Immunizations continue, and routine screenings for vision and hearing are important. Recognizing normal behavior versus signs of developmental delay is essential for safe and effective care. School-age children experience steady growth and develop more complex thinking skills. They become more independent, form peer relationships, and participate in team activities. Academic achievement and self-esteem are important themes. The NCLEX may include questions about bullying, learning disabilities, and health promotion. Understanding the physical, emotional, and social needs of this age group helps you provide holistic care and support. Adolescence is marked by rapid physical changes, identity formation, and increased independence. Puberty brings hormonal changes and growth spurts. The NCLEX may test your understanding of risk behaviors, such as substance use, sexual activity, and mental health concerns like depression or anxiety. Providing education on healthy choices and supporting emotional well-being are key nursing roles. Recognizing warning signs and providing appropriate referrals are also important. Immunizations are a cornerstone of pediatric health. The NCLEX often includes questions about the recommended vaccine schedule, contraindications, and managing side effects. Be familiar with the timing of key vaccines like DTaP, MMR, polio, and varicella. Understanding catch-up schedules and how to educate parents about vaccine safety is crucial. Questions may also address how to handle missed doses or adverse reaction. Pediatric infections such as measles, mumps, rubella, chickenpox, and pertussis are frequently tested on the NCLEX. Know the signs, symptoms, and isolation precautions for each. For example, measles presents with a rash and Koplik spot, while pertussis is known for severe coughing fits. Understanding transmission, prevention, and nursing interventions helps you answer scenario-based questions confidently. Respiratory illnesses like bronchiolitis, asthma, and croup are common in children. The NCLEX may ask about assessment findings, priority interventions, and medication management. For instance, recognizing signs of respiratory distress such as nasal flaring or retractions is vital. Knowing how to administer nebulized medications or provide oxygen therapy can be tested. Always prioritize airway and breathing in pediatric emergencies. Gastrointestinal issues like gastroenteritis, dehydration, and pyloric stenosis are high-yield topics. The NCLEX may present scenarios involving vomiting, diarrhea, or abdominal pain. Recognizing signs of dehydration such as sunken eyes or decreased urine output is critical. Nursing care includes monitoring fluids, providing oral rehydration, and educating parents about signs of worsening illness. Understanding when to escalate care is essential. Congenital heart defects, such as ventricular septal defect (VSD) and tetralogy of Fallot, are important for the NCLEX. You may be asked about assessment findings like cyanosis, murmurs, or poor feeding. Nursing interventions include monitoring oxygenation, supporting nutrition, and preparing families for possible surgical interventions. Understanding the pathophysiology and recognizing signs of heart failure are key to answering related questions. Sepsis and shock can progress rapidly in children. The NCLEX may test your ability to recognize early signs, such as fever, tachycardia, or altered mental status. Immediate interventions include fluid resuscitation and antibiotic administration. Monitoring vital signs and urine output is crucial. Understanding the differences between septic, hypovolemic, and cardiogenic shock helps you select the correct nursing priorities in emergency scenarios. Type 1 diabetes is more common in children and is a frequent NCLEX topic. You should know the classic symptoms: polyuria, polydipsia, and weight loss. Management includes insulin therapy, blood glucose monitoring, and education on hypoglycemia prevention. The exam may present scenarios involving diabetic ketoacidosis, DKA, requiring prompt recognition and intervention. Supporting families in managing chronic illness is also emphasized. Childhood cancers, such as leukemia and lymphoma, are less common but high yield for the NCLEX. Be familiar with common presenting symptoms like unexplained bruising, fatigue, or persistent fever. Nursing care includes managing side effects of chemotherapy, preventing infection, and providing emotional support. The exam may ask about neutropenic precautions and safe handling of chemotherapeutic agents. Seizure disorders, including epilepsy and febrile seizures, are frequently tested. The NCLEX may ask about seizure precautions, medication management, and postictal care. Recognizing different types of seizures and knowing when to call for emergency help is essential. Educating families on safety measures and medication adherence is a key nursing responsibility. While most immunizations are safe, mild reactions like fever or soreness at the injection site are common. The NCLEX may ask how to manage these reactions and when to report more serious side effects, such as anaphylaxis. Knowing how to reassure parents and provide accurate information about vaccine safety is important for effective communication and care. Proper nutrition is vital for growth and development. The NCLEX may test your knowledge of breastfeeding, formula feeding, and introducing solids. Recognizing signs of malnutrition or food allergies is important. You may also be asked about special diets for conditions like celiac disease or cystic fibrosis. Providing dietary education and supporting families in making healthy choices are key nursing roles. Children are more susceptible to fluid and electrolyte imbalances due to their higher metabolic rate and smaller reserves. The NCLEX may present scenarios involving dehydration, overhydration, or electrolyte disturbances like hyponatremia. Recognizing clinical signs and knowing appropriate interventions, such as IV fluid administration, are essential. Monitoring intake and output and understanding lab values are frequently tested skills. Assessing pain in children can be challenging, especially in nonverbal or very young patients. The NCLEX may test your knowledge of pain scales, such as FLACC or Wong-Baker faces. Understanding non-pharmacological and pharmacological interventions is important. Providing comfort measures and involving parents in pain management are key aspects of pediatric nursing care. Medication safety is critical in pediatrics due to differences in dosing and metabolism. The NCLEX may ask about calculating weight-based doses, safe administration techniques, and preventing medication errors. Double-checking dosages and using appropriate measuring devices are essential practices. Educating families about medication safety at home is also emphasized. Recognizing signs of child abuse and neglect is a legal and ethical responsibility for nurses. The NCLEX may present scenarios involving unexplained injuries, inconsistent histories, or behavioral changes. Knowing how to report suspected abuse and provide support to affected children and families is essential. Understanding your role as a mandated reporter is a high-yield topic. Thorough respiratory assessment is vital in pediatric nursing. The NCLEX may test your ability to recognize abnormal breath sounds, assess work of breathing, and identify signs of respiratory distress. Knowing how to use pulse oximetry and interpret results is important. Early intervention can prevent complications, so prompt recognition and action are key. Asthma is a common chronic condition in children. The NCLEX may ask about triggers, medication management, and emergency care. Knowing how to use inhalers, spacers, and peak flow meters is essential. Teaching families about asthma action plans and when to seek emergency care helps prevent complications and hospitalizations. Cystic fibrosis is a genetic disorder affecting the lungs and digestive system. The NCLEX may test your knowledge of airway clearance techniques, nutritional support, and infection prevention. Recognizing signs of respiratory compromise and providing family education are key nursing responsibilities. Understanding the importance of multidisciplinary care is also emphasized. Fluid therapy is often required for children with dehydration or illness. The NCLEX may ask about types of fluids, calculating maintenance needs, and monitoring for complications like fluid overload. Recognizing signs of improvement or deterioration guides your interventions. Safe IV access and accurate documentation are also important aspects of care. Burns are a common pediatric emergency. The NCLEX may test your knowledge of burn classification, initial management, and infection prevention. Knowing how to assess burn depth and calculate fluid needs is essential. Providing pain management and emotional support to both the child and family is a key nursing role. Thorough neurological assessment is crucial in pediatric care. The NCLEX may ask about assessing level of consciousness, pupil response, and motor function. Recognizing signs of increased intracranial pressure such as vomiting or altered mental status is important. Early detection and intervention can prevent long-term complications. Meningitis is a life-threatening infection that requires prompt recognition and treatment. The NCLEX may test your knowledge of classic symptoms, fever, headache, neck stiffness, and the importance of early antibiotic therapy. Knowing how to implement isolation precautions and monitor for complications like seizures is essential for safe care. Musculoskeletal issues like fractures, scoliosis, and juvenile idiopathic arthritis are important for the NCLEX. You may be asked about assessment, immobilization techniques, and pain management. Recognizing signs of compartment syndrome and providing appropriate interventions can prevent serious complications. Supporting mobility and rehabilitation is also emphasized. Endocrine disorders like hypothyroidism and growth hormone deficiency can impact growth and development. The NCLEX may test your knowledge of symptoms, diagnostic tests, and treatment options. Monitoring growth parameters and providing medication education are key nursing responsibilities. Early recognition and intervention support optimal outcomes. Renal issues such as urinary tract infections, nephrotic syndrome, and acute glomerulonephritis are high-yield topics. The NCLEX may ask about assessment findings, urine testing, and fluid management. Recognizing signs of complications such as edema or hypertension is important. Providing education on medication adherence and infection prevention supports recovery. Common pediatric skin conditions include eczema, impetigo, and diaper dermatitis. The NCLEX may test your knowledge of assessment, treatment, and prevention strategies. Recognizing signs of infection and providing appropriate skin care are essential. Educating families about hygiene and trigger avoidance helps prevent recurrence. Allergies and anaphylaxis are critical topics for the NCLEX. You may be asked about common allergens, recognizing early signs of anaphylaxis, and emergency interventions like epinephrine administration. Educating families on avoidance strategies and emergency action plans is a key nursing responsibility. Infection control is vital in pediatric settings. The NCLEX may test your knowledge of standard, contact, droplet, and airborne precautions. Knowing which diseases require which precautions and how to implement them protects both patients and staff. Proper hand hygiene and use of personal protective equipment are always emphasized. Emergencies in children require rapid assessment and intervention. The NCLEX may ask about the pediatric assessment triangle: appearance, work of breathing, and circulation. Knowing how to prioritize care and initiate life-saving measures is essential. Practicing these skills ensures you can respond effectively in real-life situations. Administering medications to children requires special considerations. The NCLEX may test your knowledge of oral, IM, and IV routes, as well as techniques for minimizing discomfort. Calculating accurate doses and monitoring for side effects are essential. Educating families about medication schedules and safe storage is also important. Accidental poisoning is a common pediatric emergency. The NCLEX may ask about common toxins, initial management, and prevention strategies. Knowing when to administer activated charcoal or call poison control is important. Educating families about safe storage of medications and household chemicals helps prevent future incidents. Children undergoing surgery require special pre- and post-operative care. The NCLEX may test your knowledge of pre-op preparation, pain management, and monitoring for complications. Supporting families through the surgical process and providing age-appropriate explanations help reduce anxiety and promote recovery. Health promotion is a key aspect of pediatric nursing. The NCLEX may ask about anticipatory guidance, injury prevention, and promoting healthy behaviors. Educating families about nutrition, physical activity, and safety measures supports overall well-being. Understanding developmental stages helps tailor your health promotion strategies. Mental health concerns such as anxiety, depression, and ADHD are increasingly recognized in children. The NCLEX may test your knowledge of assessment tools, intervention strategies, and family support. Recognizing warning signs and providing appropriate referrals are essential for early intervention and effective care. Palliative and end-of-life care for children requires compassion and specialized knowledge. The NCLEX may ask about pain management, communication with families, and ethical considerations. Providing emotional support and respecting cultural beliefs are key aspects of care. Understanding the unique needs of children and families during this time is essential. Family-centered care is a core principle in pediatrics. The NCLEX may test your understanding of involving families in care planning, respecting their preferences, and supporting their roles. Effective communication and collaboration with families improve outcomes and satisfaction. Recognizing the impact of illness on the entire family is important for holistic care. Legal and ethical issues such as consent, confidentiality, and advocacy are important for the NCLEX. Understanding the rights of minors, parental consent, and situations requiring mandatory reporting is essential. Providing care that respects ethical principles and legal requirements ensures safe and effective practice. Covered a wide range of high-yield child health topics for the NCLEX exam, from growth and development to emergency care and legal considerations. Remember to focus on understanding key concepts, practicing scenario-based questions, and reviewing guidelines. Prioritize safety, communication, and family-centered care in your answers. With thorough preparation and a clear understanding of these topics, you'll be well equipped to succeed on exam day. Good luck with your studies and your future nursing career.